Assalamu alaikum wa rahmatullahi wa barakatuh. Peace be upon you all. Bismillah ar-Rahman ar-Rahim. Wassalatu wassalamu ala ashraf al-mursaleen, Sayyidina wa habibi qulubina Abil Qasim Muhammad. Peace and blessings be upon the Holy Prophet and his holy family. Salawat. Muhammad wa Ali Muhammad. Thank you very much for Al-Zahrat Center, Learning Center, for inviting me to your lovely community. It's been amazing so far. Yesterday we had the beautiful Ladies Gala for women empowerment in honor of Sayyida Zainab. We had a lovely evening, although we came straight from the plane and missed most of the program, but we enjoyed our ladies chat afterwards. And earlier today we had the wonderful nutrition and mental health with Sister Mona, who you are very lucky to have in your community to learn so much from in terms of mental health and good health and Islamic health, I would say as well. And this evening, inshallah, I always like to begin this presentation, which I've had the honor of traveling the world and presenting to different communities on Muslim mental health. And I always like to begin the discussion around this beautiful ayah in the Holy Quran from Surah Al-Ra'd, Thunder, which expresses guidance from Allah subhanahu wa ta'ala to attaining that inner peace through dhikr and remembrance. And please say it with me, Bismillah ar-Rahman ar-Rahim, Ala bi dhikrillah tatma'inna al-qulub. Verily, with the remembrance of Allah, the hearts find rest and peace, tranquility, right? So it is this remembrance and this type of reflection from the Holy Quran and the Ahlul Bayt, peace be upon them, that teaches us the holistic aspect of how to reach and attain that inner peace. And in this ayah, as we see, it's through that remembrance, through that dhikr. So throughout our presentation today, we're going to take a look at, pursuing the knowledge, which is a noble characteristic embodied by the Ahlul Bayt, teaches us to pursue that knowledge from cradle to the grave, right? Or seek it as far as China. And this also includes learning about our mental health. Although when you first hear the word mental health, it could be perhaps something that is a little taboo, perhaps in our communities, perhaps something that is not welcome. There's a lot of misconceptions and stereotypes around that. So by the end of our presentation today, inshallah, we'll be comfortable with that. We're not going to be weirded out, as they say, about this topic. We're going to look at being comfortable in terms of being ambassadors in our community on mental health. I just want to put the disclaimer out there because I see a lot of young people here. There shouldn't be anybody here under the age of 14. So for those who are under 14 years old, because we will be touching upon sensitive topics. So if we have people under 14 years old, if they can go with Hajia in another room, because I don't think the topic is appropriate for that age. Inshallah, in the future, we can do mental health for the younger ones, but for tonight, I would recommend the ones under 14. I know you guys are eager. You can come back later when we do the mindfulness meditation. Hajjia, let's bring everybody back. All right, so we'll just do a loud salawat while we wait for the little ones to step out. And like I said, Salli ala Muhammad wa ali Muhammad. We want to include our young ones in these topics, but tonight, specifically as a mental health 101, I think it's better, and you'll see why when we get into it, that it's not very age appropriate for them. But inshallah, in the future, we can do specific topics around them. So while they're waiting, you're seeing me lay out some items here. So I'm going to tell you what these items are about. These items are specifically from the Holy Lands in Iraq. This past ziyarah, I got a chance to go in Muharram, as well as in Arba'in. And I got the chance to work with a local organization there with widows and orphans around mental health. So we see in our communities, we've gotten that far to the point where, come back to our homeland in Iraq, where they see the importance of mental health to reaching a vulnerable population there. And we got a chance to train the local staff with Mu'assasat al-Ain, which I'm sure you've heard of as well. We did training with staff there. And so always when I come back from my travels from ziyarah, I always bring goodies from ziyarah that I find encourage people, let's participate. So when I'm going to speak today, it's not just me. Inshallah, all of us will participate together, and anybody who's brave enough to start the conversation will have some of these beautiful blessings. So let's begin, inshallah. Salawat ala Muhammad wa ali Muhammad. So inshallah, this evening we're going to take a look at what mental health and well-being is all about. We're going to look at some statistics, misconceptions, barriers, and common illnesses. We're going to look at what is counseling, gender variances, the signs of depression and anxiety, and then looking at support and resources. At the very end, inshallah, we'll be demonstrating a mindfulness meditation. Then inshallah, we'll have you feeling as though you were floating before you leave. All part of self-care, all part of taking care of ourselves, especially in stressful times, which can help prevent mental health challenges and disorders. It's also fun to do because it's a very fun, relaxing activity. It's always nice to end, inshallah, dhikr of Allah in a different way. So let's jump right to it. But before I do that, like we did earlier in our health program, the nutrition one, I'm going to ask some questions. We're going to be interactive. So when you first hear the word mental health, okay, I'm going to start with Abu Fadl al-Abbas Fidwa al-Isma. I got this from Imam Ali, near the Imam Ali shrine, I remember in Muharram. So I'm going to start with asking a question. Who would like this? What comes to your mind when you hear the word mental health? Mental health. First words that come to your mind. Mental health. Without anxiety, okay? Tfaddal. Inshallah, ziyarah for you, inshallah, one day. Have you been before? Inshallah, ya Rabbi. Pray for you to go and you wear that there, inshallah. Thank you so much for sharing. Without anxiety. Psychological well-being. What else? Mental health. When you hear it, just say what's on your mind. Few words. Anxiety, depression. Go ahead.
I think positive mental health is being able to having the mental capacity to deal with any problems that may come your way.
Okay, excellent.
And to enjoy
Excellent. Thank you. What else? Stress, yes. What else? Anybody here on this side, the gents side? When you hear mental health, what comes to your mind?
managing stress, coping with stress, managing stress.
Managing stress, yeah. I'm hearing a good mix of things here. Some people mentioned, yes?
I think the social determinants of health, things such as income, housing, funding, social support.
Given us quite a few answers, sister.
Thank you.
This is from the side of Abu Fadl al-Abbas, yeah, from near his shrine area. So I've been hearing an interesting mix of answers ranging from people talking about psychological well-being and people talking about actual mental illnesses. You notice what I said though, I said mental health. I didn't say mental illnesses. And so that's why sometimes we get the confusion with our answers, or we think we're saying an answer that is related to the topic when we say mental health, but I said mental health, not mental illnesses, right? So let's take a look at some of these definitions here. So according to the Canadian Mental Health Association, mental health means striking that balance in all aspects of your life, the social, physical, spiritual, economic, and mental. And when we take a look at what the World Health Organization says, it takes a look at being defined as a state of well-being in which every individual realizes his or own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. So you see, what we see here is what? Balance, that overall holistic balance. And what's interesting here, like I said, I didn't say mental illness. Mental illnesses occur, or mental disorders occur when we don't take care of our mental health, just like our physical health. We all have physical health, right? When you say physical health, what comes to your mind? Yeah, like how well your body is, right? We don't talk about, oh, how sick your body is. We talk about how well your body is, right? So again, that well-being when it comes to physical health, right? We talk about exercise, healthy food. Same thing when it's mental health, talking about the positive aspects of it. If we don't take care of our physical and mental health, then we can fall into illnesses or challenges, right? So that's the first thing I want to keep in mind. When we talk about mental health, it's about that overall balance of all aspects of our lives, right? So it's a basic definition, but why is it then? And I'll tell you a little joke about a story of when I first started learning psychology. And coming from an Iraqi community, people would ask me, "شو حتدرسين?" You know, "شنو قاعد تدرسين? What are you studying?" And I say, "Psychology, علم النفس." And they're like, "Oh," and I'll translate, "راح تصيرين مجنونة مثل هذول راح تداريهم وتعالجيهم." You're going to be just as crazy as those people that you're going to be treating. And as funny as that is, the reality is, well, it's not about that, right? It's not a contagious thing kind of thing, right? So it may be funny, but then the reality is it's not funny when we're talking about the statistics of 1 in 5. 1 in 5 people, Canadians, are going to be impacted by mental health challenges in their lives, right? So it is a serious matter. It is something that we need to take more seriously in our communities, especially because we are part of the greater Canadian community where we are experiencing these challenges, right? So we don't want to shy away from them, we want to face them. So let's go a little bit deeper here, further, when we take out what mental well-being is all about, right? So maintaining an optimal level of wellness is absolutely crucial to live a higher quality of life, right? Wellness, why does that matter? Because everything we do in every situation, or sort of rather every emotion we feel relates to our well-being. And in turn, our well-being directly affects our actions and our emotions, right? So it's this ongoing cycle. So it's important for everyone to achieve that optimal wellness in order to reduce stress, reduce the risk of illness, to ensure positive interactions, whether within our society or community, right? If we go a little bit further, we take a look at what the University of California Davis campus postulates. So they have the Student Health and Counseling Service where they take a look at these 8 dimensions of wellness, where we see that each dimension of wellness is interrelated within the other, right? Each one is equally vital in the pursuit of that optimal health. And one can reach that optimal level of wellness by understanding how to maintain and optimize each of the dimensions of wellness. Now, if we compare this from an Islamic or a psycho-spiritual perspective, we compare it to the hadith by Imam Musa al-Kadhim alayhi salam, where he says to divide your time into 4 parts. An hour to Allah subhanahu wa ta'ala, an hour to work, provide for your family, an hour to socialize with friends, those who are, of course, trustworthy and can keep your secrets. And last, an hour for yourselves where you can perform what you desire without falling into haram. So you see here, these 8 dimensions of wellness, they fit into the 4 categories that Imam Musa al-Kadhim taught us 14 centuries ago. And I always like to say that the original psychologists, you could say, were the Ahl al-Bayt, alayhim as-salam, where they taught us holistically how to live our lives, right? So you see, all 8 of these dimensions, they fit into these 4 parts. Sometimes people say, well, how do I balance these 4 parts? Sometimes I need to work more than I can see my family. And the way I answer that is to say, well, it's not necessarily about dividing that time equally, time-wise, number, hours, but it's the quality that you spend with your family, for example, and your friends. Right? Because sometimes we spend a lot more time, our kids spend more time in school than they do with us during the work day, the school day, right? 7-8 hours, and then they come home, do homework, dinner, and boom, straight to bed. Probably see them, 2-3 hours, a little bit in the morning. That's a lot of influence from their friends and peers, right? But it's the quality time that you spend with each other when you look at dividing up your time here, okay? So let's go a little bit further here in terms of some statistics to help us understand a little bit more. Like we said earlier, 1 in 5 people in Canada will personally experience a mental health problem or illness in their lifetime. Or they may know somebody, family, coworker, friends, right? Mental illnesses affect people of all ages, backgrounds, cultures, income levels, education, doesn't matter, right? 8% of adults will experience major depression at some point in their lives. 10 to 20% of Canadian youth are affected by a mental illness or a disorder. 5% of male youth 12% of female youth aged 12 to 19 have experienced a major depressive episode. If you think about it, that's a lot of our youth that fit into this category, right? Suicide is amongst the leading causes of death in 15 to 24-year-old Canadians, second only to accidents. 4,000 people die prematurely each year by suicide. In the States, Center for Disease Control also state the similar statistics when it comes to suicidality amongst young people, right? That's why I said I didn't want some of the younger people in here, because we're going to touch upon sensitive topics that could also, and that's why I always say also at the beginning, that could be sensitive to you as well, right, and your family members. So if you find yourself affected, need a moment, just step out. It's good to talk to your also mental health care provider if you have one, if anything we talk about today might upset you or trigger you, which is a normal response. So don't feel shy or embarrassed if you need to take a moment to step out. It's all right. Now, what's interesting here when we come to suicidality, we see that men are, the statistics for men is 4 times the rate compared to women when it comes to depression, to ending their lives, right? Now, the economic cost of mental illnesses to Canadian healthcare and social support system was projected to be almost $80 billion for the year 2021. And we know this has risen from before due to the pandemic, right? We know there's been so much happening the last 2 years in the pandemic that it has isolated people, and a lot of young people. It's the number one issue that we have with children these days because of the pandemic is mental health challenges, especially those who've been out of school, back in school, back and forth, and being isolated from their friends, right? Because that social interaction is vital for children to have their natural development, right? $6.3 billion was spent on uninsured mental health services and time off work for depression and distress that was not treated by the healthcare system. And because public mental health services are underfunded and have long wait times to see a specialist, or because this is something that most people will pay out of pocket if you don't have insurance coverage, right? And we'll talk a little bit later about who the mental health professionals are and how they're covered by the Canadian public care system. So you see that if you have employer-based benefits, or that can help you, you have to pay out of pocket for the private services. And Canadians spent an estimated $950 million a year on psychologists in that private practice field, and about 30% is paid out of pocket, while the remainder is paid through the employment-based private healthcare insurance. So this is not as accessible, right, as we see when it comes to, let's say, medical treatment, although you still sometimes have to wait quite a bit to see a specialist, right? Because it is covered by your provincial healthcare system, but then it's hard to get to that specialist because it is free, basically, right? So let's take a look at what are the misconceptions, what are some of the main barriers that we experience within our Muslim community, and what are also some of the most common mental health illnesses in the Muslim community. And I'm going to need your help on this one here, okay? So when we talk about myths and facts about mental health, we know that, like we said earlier, mental health affects everybody, right? We are all likely to know somebody who has experienced some kind of mental illness at some point, yet there's still so many hurtful attitudes around mental illnesses that fuel that stigma and discrimination, make it really hard for people perhaps to reach out, right? So let's look at the facts and myths here. Number 1, mental illnesses are not real. True or false? Who said that? Who said that over here? Is here? False. Thank you. This is either from Imam Ali or Abu Fadl Abbas, one of them. Both a blessing. So the words that we use to describe mental illnesses have changed, right, greatly over time. We see about 10, 15 years ago, we just started talking about mental health. And I know it was only around 8 years ago that in my clinic on campus at the university where I work at, it became a little bit more common to talk about that. Now it's like standard. Now we have doctors who are fully trained and talk about mental health, and it's common. It's like, hip words or current words that everybody uses, right? It's normal. But back then it wasn't, and I find in our Muslim community, especially the Shia Muslim community, we're a little bit behind when it comes to mental health awareness in the one-on-one. This is part of why we're doing these types of things, right? Because we know that mental illnesses, what they do is they create distress, right? They don't go away on their own, and they are real health problems. However, they have effective treatments, right? When someone breaks their arm or leg, right, we wouldn't expect them to get over it. We would never say that to somebody like that, right? Or if they have diabetes and their sugar crashes, the glucose levels fall, they become dizzy or faint, right? Do we tell them, get up, get over it? Or do we rush to them and help them, right? So we wouldn't blame them either, right? We wouldn't blame them if they needed, let's say, a cast or a sling for their arm or their leg. Or we would help them, right? Usually we'd be the first to go rush and say, can we do your laundry? Can we cook for you? Do you not want us to help clean your house, take your kids to school, et cetera, right? But why is it that when someone has a mental break in their mind, their soul, we run away? We hear about somebody who probably attempted suicide or had a psychotic breakdown. Shh, right? Quiet, don't say anything. Hush, hush. Dust it under the carpet. Whereas we need to have that same compassion, right? Inshallah, by the end of our presentation today, we'll get to that understanding and compassion so that we can reach out to those who need that support and help, right? Number 2, mental illnesses will never affect me. False, right? Yeah, we said that all of us could be affected, right? Researchers estimate as many as 1 in 5 will experience it at some point in their lives. Or if you don't, you may know somebody, right? Family, coworker, etc. Neighbors, right? Number 3, mental illnesses are not just an excuse for poor behavior. Are just an excuse, so they are. False? Yeah? So it's true that some people who experience mental illnesses may act in ways that seem a little strange or unexpected, right? So we need to remember that it's the illness, not the person, right? The illness, not the person. One of the sisters last night disclosed in our group, she was very open about it, and I hope she doesn't mind that I share this, that she said that she has anxiety, and she also has tics, Tourette syndrome, which causes her to make strange sounds and so on. So she feels she has to keep it in, really work hard on keeping it in. And that's hard in school when you're trying to focus on learning, but then you have this, and you have to hide it because you're so embarrassed of how people will respond because it's strange, right? Funny enough, after our discussion last night, and even today, she said, I'm not going to hold back anymore. I'm just going to explain things to people. And that's what I've learned over the years, is just to explain to people. So when they see it, they're not put off, or they don't know what it's about, or they're weirded out, or they leave, So this is about normalizing things like that. And so it's really important also that when we take a look at behaviors, right? It's not poor behavior. It's not deliberate. Right? No one chooses to experience a mental illness, right? So people who experience a change in their behavior feel really embarrassed and shy, just like that sister was telling us earlier, right? They're ashamed to be around others. It's also true that people with a history of mental illnesses are like anybody else, right? They make poor choices, just like anybody else, right? Or do something unexpected for reasons unrelated to their symptoms. Number 4, bad parenting causes illnesses. False? True? Why is it true? Why do you say it's true? Whoever said that?
Bad parenting and abuse could potentially for children anxiety.
Yes. Yes. So when we put it this way, in terms of abuse, right? Definitely abuse can cause a lot of trauma, which can cause depression, anxiety, and other challenges later on in life, right? The idea behind this concept here is that there's no one factor that can cause mental illnesses, right? These illnesses are complicated conditions that arise from genetics, biology, the environment, and life experiences, right? Family members and loved ones, also, however, they have a big role when it comes to support. And when we talk about it from abuse, absolutely that can trigger that, right? Number 5, people with mental illnesses are violent and dangerous. Not true? Kind of? How so?
Depends on the condition, like sundown, sunrise, when it's night, it causes people to act strange and weirded out and violent.
Potentially, yeah. So there is a link. So some people, researchers, they try to predict violence so they know what to avoid. However, the causes of violence, just like we said for childhood mental illnesses, they're complicated, right? Researchers agree that mental illnesses are not a good predictor of violence. They are not. So in fact, when we take a look at mental illnesses on their own, people who experience them are no more violent than people without an illness. However, excluding people from communities, that is linked to violence. Excluding, right? And people with mental illnesses, they are often amongst those who are excluded. That's the link. So it's also important to note that people who experience these illnesses are much more likely to be victims of violence than to be violent. So the link is what? The isolation part, excluding them, right? Number 6, people don't recover from mental illnesses. True or false? False. So just like physical illnesses, you can work through them, you can get over them eventually in time with medication, support. However, there could be some illnesses, just like somebody, let's say, who's diabetic, somebody who has cardiovascular diseases, right? Because it could be something that they're going to live with for a lifetime. But what do they do with that? They manage it, right? With perhaps medication, treatment, right? So same thing when it comes to your mental health illnesses, right? Because there are all sorts of treatments, services, and supports that can help with recovery. Those who are going to be lifelongers, so to speak, when it comes to challenges such as ADHD, so attention hyperactivity deficit disorder, is something that not necessarily, you outgrow it, but perhaps you learn how to cope and manage so it's not as intense. But also you see that a lot of people can lead productive, engaged lives. They work, they volunteer, they contribute to their societies with their unique skills and abilities, right? So even when people, like we said, have these illnesses for a long time, they can learn how to manage their symptoms so they can get back to their goals, right? So there's different approaches. And again, the way we look at it, if we can look at it like a physical challenge, right? An illness like that, then we can look at how to manage it better. Number 7, people who experience mental illnesses are weak and cannot handle stress. Some? I like the realistic approach here, yeah. Some, yeah, sometimes. But let's take a closer look here. So we know that stress impacts well-being. But that's true for everybody, not just those who are struggling with mental illnesses, right? So people who experience these illnesses may actually be better at managing stress than people who haven't experienced anything. Because many people who experience them, they learn skills like stress management, like the sister mentioned at the very beginning, right? Stress management, problem solving, so they can take care of their stress before it affects their well-being, right? Taking care of yourself, asking for support and help when you need it, these are signs of strength, not weaknesses, because just like our prophet taught us, prevention is better than the cure, right? So that's a really important point to remember. Number 8, people who experience mental illnesses cannot work. Some. False, some, right? Same thing as physical health challenges, right? Wouldn't you say? So whether you realize it or not, workplaces are filled with people who have experienced mental illnesses. You just don't see it, like a physical disability or a physical illness, right? So mental illnesses don't mean that someone is no longer capable of working. It's just some people can benefit from changes at work to support their goals, right? So, but many people work with few supports for their employer. That's the reality, right? Inshallah, now more and more as mental health becomes something more normalized, including the workplace, people can take a mental health day, not just a sick day. We're moving towards that, right? So most people who experience these illnesses want to work, but they face systemic barriers to finding and keeping meaningful employment. And I hear this a lot from students who fear when they graduate because of their severe mental illnesses, they're not going to be able to get a job and keep it. But we know there are employers out there who value and respect the skills they have to offer and have workplaces that appeal to these people, help them out, but also just like people have physical health challenges as well, right? Doesn't mean they don't have something useful to contribute. They do, right? But we have to figure out how's the employer going to be, let's say, accommodating, right? Number 9, kids cannot have mental illnesses like depression. Those are adult problems. False, yeah. Even children can experience them, right? In fact, many mental illnesses first appear when a person is young, right? They look different in children than in adults, but they are real concerns, right? They can impact the way young people learn, brain development, how they build skills, which can lead to challenges in the future. I know this firsthand as a psychotherapist at university level. I see many, many students who come in struggling with attention deficit challenges. They come in at first talking about depression, anxiety, symptoms around there. They're concurrent, which means that it happens around the same time as you have another potential illness or challenge, right? Or a disorder, right? So it's interesting that those with ADHD, when they come in describing symptoms of depression and anxiety, when we start taking a look at the issue, which isn't these, the issue is ADHD, and look at getting diagnosed, assessed, perhaps with medication, getting support in terms of the way they learn, because people with ADHD, the way their brain functions is different than somebody who doesn't have it. They're wired differently. The way they process information from the world around them is different than somebody who doesn't. So that becomes a challenge for a lot of people who don't do well in school, right? And why are they depressed? Well, because they're not doing well. They're not socially progressing. They're not getting to their goals. When we treat the root cause of an issue, these disappear. I'll tell you a quick story of a young man who gave me permission to share a story. He was a Muslim revert from the Caribbean. And I remember he used to come in, he's stuck in university for 7 years. His peers have graduated and he feels so depressed, so sad. And he's anxious about school and exams. And he's just not doing well. He's unhappy. And the list goes on ila akhirihi. So when he came in, he's like, sister, I'm really struggling. You know, people graduated and I'm stuck. I'm not doing well at my work. I'm not doing here. I feel really low. And then I noticed a trend. This was in my early days as a therapist. I didn't catch it right away. He would miss appointments. He'd be late for appointments. He'd forget about appointments. And we attribute it to the depression. One day it occurred to me, like, why don't we take a look at this? I'm going to refer you to our specialist that we have in our office, because you need a specialist to assess for that and diagnose it. We did that. SubhanAllah, we were right. It was ADHD. The doctor gave him prescriptions. When I saw him again, he didn't take them. Why didn't you take them? Why didn't you take the medication? Well, my mom, you know, she's a nurse, and she said, don't take them. You're going to get addicted to them. Also in my culture, you know, we don't believe in mental health. I'm like, oh, you sound like an Arab like us. You know, this is pretty common in our communities, right? Brother, please take the medication. Take the medication. You make the decision for yourself. I'll see you next week. I kid you not, when he came the next week, it was as though it was a different person. SubhanAllah. It was that dramatic. In that 1 week, he was able to get A+ on his assignments. He was able to focus, concentrate. He was no longer sad, no longer anxious about his assignments. The medication helped him focus and get back on track. But he's been struggling since childhood. Khataya, as we say, I'm shahar, you know, the poor guy, Ma'attar, you know, he really struggled from a child leading up to university and feeling so bad about himself. When he finally took the medication, he also got the support that we have for students with physical disabilities as well as mental disabilities. He got a coordinator and a learning strategist to help him with his studies. Night and day difference. SubhanAllah, his depression and anxiety were gone. Those were concurrent. They were not the root issue. Not only that, okay, on top of that, he was also noticing people around him, his friends. He started tutoring his friends within those few weeks and started saying, go see Barak at the clinic. You have the same thing I do. MashaAllah. So we have stories like this. As soon as you get the proper treatment and follow-up and support, look at them, how they just, wow, ينطلقون, right? They just like flourish, right? And so this is something we need to work on in our communities, is not to fear the treatment, not to fear the so-called label that we get, right? We'll get into that in just a moment. So that's why it's crucial that our children, if you notice a change in their behavior, or you notice they're very active, right? Don't say, oh, hada waqih, you know, oh, this is a really bad kid, right? As we say, oh, he's very, you know, no. Look at him from the eyes of compassion. Perhaps this child is struggling in school if they're acting out, so on and so forth. Don't blame the behavior on the person. Look at what the root is, because I see those students later on, when they come, they've slipped through the cracks like this brother, and they're struggling for years. Why? Because parents don't want to go get, and I know in our community, I hear it for some parents when I see their kids, And I don't come and tell them, oh, I think your kid has this. I say, have you spoken, to their teacher? Have you spoken to your doctor? Maybe, go to your doctor, talk about some of these behaviors. Because I know how our community is right away, like, no, there's nothing wrong with my kid. They think it's a reflection, a negative reflection upon them. But it truly isn't. It's the challenge, it's the disorder, it's the illness. And if we don't catch it young with our kids, they will suffer and struggle later on in life. Interestingly enough, over the last few years, I've seen a lot of male students, especially international from the Middle East, the Gulf area. For some reason, Khalij, the Gulf area, I see a lot of these students that come who struggle with ADHD and ADD. I don't know why. It's because maybe it's something that's not caught early on in the school system over there because they don't really look at these things perhaps. So when they come here, they're struggling at the university level. And I had one student, when I told him, he ran out of my office. I never saw him again because he was so afraid of what that meant. But then those who do face it and see the amazing support around them, these are the ones, alhamdulillah, that succeed. Number 10, everyone gets depressed as they grow older. It's just part of the aging process. False. Absolutely, right? Depression is never an inevitable part of aging. We saw children very young can experience that, right? Older adults may have a greater risk of depression, however, because they experience so many changes in their roles, in their social networks. I find within the Muslim community, not so much. Why? Because of our prophetic tradition, right? Of respecting and valuing and honoring our parents, right? Just as they have done for us when we were children. We then become the caretakers of our elders, just like they took care of us. This is embedded in our faith, right? See beautiful's love and support here. Absolutely. You don't really hear much of us kicking our parents out of our houses and putting them in living retirement homes. Hardly. Unless they're, let's say, really difficult physical ailments where they need that personal support work and help, rather, right? But it is rare. Our parents live with us, right? Or sometimes we live with our parents. It's a very different dynamic than, say, non-Muslim communities, right? There are other cultural and faith groups that are similar to Muslims when it comes to our elderly parents and elders, right? So I find in our communities it's a little bit different that way, but it's the change in roles. My grandmother, Allah yarhamha, I remember, even though she wasn't functioning after having 9 kids, mashallah, and all these grandchildren around her, and I grew up here, I never really grew up with grandparents because living here in the West until later on I was able to go to Iraq and see the family and ziyaras and all that. So I saw little bits of my grandmother over the years before she passed away. And what I loved is that she still had an important role as a widow, as the elder in the family, right? Where, for example, my aunt, who she lived with, would bring her al-khudra, and for her to work with that, she still felt useful doing something. Although she used to head a household of 9 children, in Karbala, with the ziyarat and the khidmah and all that, she still had an important role in the family that was honored, That helps with our elders when it comes to their social roles and so on and so forth. All right, and one of my favorite ones here, the Muslim myths that we have also when it comes to jinn possession, lack of faith, leading to poor mental health, right? So this one's a tricky one because we know, for example, there's hasad, we know there's ayn, we know in the Quran there are specific surahs that help protect with that, right? There are some scholars who refute this concept, and there are those, who include it. So it really depends on you and what you believe and so on and so forth. The scholars, the sheikhs, the alimas that I worked with over the years, and one in particular stands out in my head because I call them the frontline workers. In fact, today I was doubling up coming here, but I was also working with the Marja'iyya. They had their strategic planning meeting in Dearborn. I couldn't go. So they included me virtually, and then I was saying the same thing to them. You are the frontline workers in our community, right? The sheikhs, the alimas, these are the people we go to first in our community if there are family problems, marital problems with our youth, right? Or if our children or anybody start behaving strange. You notice that. We go to them. They're not trained counselors, though, or therapists, right? But they have spiritual remedies, right? And those are existent, like it's actually there. So it depends on what you believe. I've seen very strange things, but I remember this one sheikh over the years, what he told them is, don't come to me, I cannot heal your child. They thought he was possessed. He's got a psychotic breakdown, take him to the emergency hospital. I can't do anything. But this sheikh specialized in these areas, subhanAllah. He said this is not this, he needs to go to the doctors right away. So we need to be aware of this. Because right away we're like, oh, كتبوا كتاب عليا, حسدوني, إلى آخره. We need to kind of shy away from that, jumping to that right away, and including that maybe there is a mental health challenge here that we need to explore, right? Sometimes people are not getting the right assessment and treatment. So it's really important to recognize that. Thank you for all of your participation. I kind of forget and leave these here. So if you didn't get something, we can get something later, inshallah. So let's take a look at what are some of the main barriers that we experience in our communities to getting help, getting support. Who can share with me? What do you think are some of the main barriers?
One thing might be like for kids, when they tell their parents that they think they have anxiety or they think they have depression or whatever, parents might be like, that's not real or this is not false. They might automatically blame it on something without actually understanding.
So they might actually blame it on the child. So maybe looking at kind of like discrimination and fear. Yeah?
Like they might blame it like on the phone or on his friends.
Okay.
Or like they might be like, well, you're still eating and you're still sleeping, so you don't have depression.
Okay. All right. That's interesting because they see you interacting in other ways, but you're not doing other things that you should be doing, right? Thank you for sharing. Yes. So the question was, what are some of the main barriers when it comes to mental health within our community? Yes, sister. Parents? Parents. In what way? Like what the sister was saying, or how are parents a barrier? It's not true, yeah, absolutely. So parents perhaps are not educated enough in the area, or they don't believe in it as something. Yeah? Culture.
Difficult for me to believe that my case is suffering from disorder or that is a mental order. So I think, yeah, I agree that education is very important.
Yes.
But again, it's to change the culture, that is
The culture. Yeah, absolutely. Yeah. Let's jump into them here. Language. So there's two concepts behind this. So language and the way we speak, like people who speak Arabic may want an Arabic speaking counselor, right? May not understand. The other part is the language that we use when it comes to mental health. For example, people get shy away. Like I can't go to somebody and say, when I see something, you're clinically depressed, although I can't diagnose. But you're clinically depressed. People hear, oh my goodness, the label on me, they become terrified. Right? So maybe what can we look at is using the language of mental health rather than saying, depression, ADHD, anxiety, bipolar, whatever it is. We could say maybe along the lines of, it looks like you're tired all the time. You're not as engaged as you were before. You seem very sad. You're not doing well in school. Your hygiene is off. You didn't come to the youth group last week or the other one. So you see, using the language of depression, right? Or when it comes to anxiety, you seem very nervous, right? You're agitated, you're shaking, right? Or you're overthinking. Instead of saying somebody, you're anxious, you have anxiety. So that's what I mean by language as well. That type of language I find pushes people away. Whereas if we use the symptoms to describe the challenge, the disorder, the illness, then people are more likely to be, open to that. They'd be more approachable to perhaps understanding a little bit more. Access. Access, right? What does that mean? Meaning, where do we go? Who do we go to, right? Where do we go? Okay, so where do you go for resources, right? So when it comes, yeah?
Local shops, like, to get resources.
Yeah, where would you go to access, like to get some support? That's the next one, resources, yeah.
And then, hospitals and
Okay, so let's say, la samahallah, something happens in your community with somebody, you know, if you break an arm or a leg, you know, you got a cold, you know, these days you go get COVID testing, right? We know the drill. Isolate, do this, this, and that. But when it comes to mental health challenges, what do? We go to the sheikhs, right? Again, frontline workers. And some of them like, I can't do anything. Go to the hospital or go to the doctor, right? So let's look at who the mental health practitioners are. I don't have it written here, but I'll tell you verbally. When you hear mental health and treatment, who comes to mind? Therapists, right? That's a pretty general word, right? There are many different types of therapists in terms of offering treatment. Have you heard of a psychiatrist, right? Okay, so a psychiatrist is somebody who studied medicine and specialized in psychiatric disorders. So they would treat things such as schizophrenia, major depressive disorder, personality disorders, right? Because they are medical doctors specializing, just like you have cardiologists, hemoglobin, right? You have psychiatrists. They can diagnose, right? And treat with medication they prescribe. They can also do the therapy. They kind of have the stereotype that other therapists throw on them and say they're pill poppers. They'll give you a pill, see you in 6 months. They don't actually do the treatment. One time I said that in London, England. Oh, psychiatrist got up in the middle of the audience and said, no, we're not like that. I'm like, it's a stereotype. Not all are like that. Some are amazing in terms of doing actual treatment, right? Therapeutic treatment. So a lot of them are known to give medication and see you in a few months because there's such a load on them. Why? Why are psychiatrists so sought after? Because they are covered by the provincial medical system. Hence, they are free. Hence, there's a long wait list to see them. They're a specialist, right? Then you have psychologists. Psychologists do graduate studies, PhDs, right? And they're clinical, and then they're experimental psychologists. What does that mean? Clinical means they do treatment. They can diagnose, treat, but they cannot prescribe medication. Why? Because they're not medical doctors. Experimental psychologists, they can also do this, right? But they are the ones where we get the statistics from. They do research, right? They do clinical trials. They experiment. They give us resources and data that we use when we talk about this study, that study. Studies show. It's experimental psychologists, right? Industrial psychologists. There's lots of different psychologists, right? So that's your psychologist. They are also specialists, and they are sought after if you've got the employment benefits. Otherwise, you pay out of pocket, and they can be very pricey, right? They got private clinics as well. Then you have psychotherapists. Which one am I? I'm a psychotherapist, right? So what do psychotherapists do? So we also have graduate studies, okay? We're also part of a registered body, just like doctors, just like lawyers, just like social workers, just like plumbers. We're all part of their own registered body, right? Where we are liable to the public to protect the public, right? Just like the others as well. So we have our graduate studies, we have our license to practice. We can assess, meaning we can say, well, this person exhibits these symptoms, but we cannot clinically diagnose. Because I work in a medical clinic, I've got the advantage of referring to the doctor or a psychiatrist or our psychotherapist, general practitioner, GP psychotherapist, the next one. These guys are like unicorns, I call them, because they're rare or non-existent. They're amazing. What do? They do kind of what we do in terms of the actual treatment. We also don't cost as much as the psychologist, right? And universities like hiring us because we're part of where we do the therapy, right? So there's a difference also between counseling and psychotherapy. Psychotherapy is when you are treating a diagnosed disorder. Counseling could be what I do as well, most of the time with students, which is dealing with stress, right? Dealing with, let's say, people who are not necessarily diagnosed, but are dealing with family issues, that are dealing with work issues, school issues, academic issues, right? It's a university, stress, number one, stress, right? So we're doing counseling based on that without necessarily a diagnosis. But a lot of the people nowadays we're seeing, there seems to be some diagnosis around that. All right, so let's speed up. Psychotherapists, GP psychotherapists, they can diagnose, they can prescribe, and they do the treatment that we do. They're an all-in-one. They're great. They're also covered by the provincial healthcare system because they're medical doctors. We're not. We would be covered under your employment health insurance or paid out of pocket. But because we're at the university, they pay our salary. Students come in because it's part of their health plan that they've already paid ahead of time. Okay? Then you have social workers. They're like us, but they do case management. Some do therapy, some don't, but they do case management when it comes to social services, within the community, immigrants that come in, transition, adjustment, et cetera, et cetera. Each has a role. There's also child youth workers. They're like us in terms of having, being part of a registered body as well. Now, I'm sure you've heard over the years of life coaches, you know, spiritual coaches, everything coaches. The last 2 years has been coaches like this everywhere because of the pandemic. Everybody seems to be an expert from their own personal experiences. Everyone's got a role to play. However, you have to do your research, just like you would when you go to physical, get treatment for physical illnesses. You research who you go see, right? Life coaches are not registered and liable. They're not trained like psychotherapists and doctors and psychiatrists, psychologists, right? So if there's an issue, they're not liable. They'll probably take your money and go, and they can't really do anything else when it comes to proper mental health support. They have their role in terms of encouraging, inspiring, empowering, absolutely, right? But just be aware of who you go to seek help from. Which brings us back to resources. Now that we have a better idea of who the mental health professionals are, if you're likely to run into a problem, who are you going to go see now? Your family doctor, right? First person you go see is your family doctor. If you're in a high school, you're in school, university, who are you going to go see? Go to your counseling services, right? To talk to a counselor, right? To start off there. Parents, you take your kids to your doctor for them to do an assessment, to diagnose, to see what's going on, and then they can refer you to a specialist, whether it's a therapist or a psychiatrist, psychologist, et cetera, okay? Are we good now on resources? Yeah, you guys know now what to do. La samahallah, if you know somebody, then you can encourage them, hey, let's go together, all right? Just like you would with a physical challenge, right? Culture, we mentioned that earlier, right? Because there's so much shame, discrimination, fear, right? Especially in our communities when we say, pray more, read more Quran, do more dua. I'm not saying there isn't. There's a huge link between spirituality, faith, and mental health. In fact, I did a research on it, but not research, experimental. It was more of a qualitative research. A few arba'ins ago, we did interviews with people of how does the ziyarah impact your well-being and mental health. And we were seeing what people would say. If you want, there's a documentary on the Muslim Counselor YouTube page that we did on this very topic, where we did bring in research from different backgrounds, not just Muslim research, but from different research looking at how does spirituality impact your well-being. There's a huge positive, significant link between the two. Absolutely. But when somebody comes to you with a broken leg, culturally, are you going to tell them to go pray more when they're in pain, they're bleeding in front of you? No, we're not going to do that, right? Same thing when it comes to mental health. We don't want to use that language in our culture. That's going to push people away from you, right? Or doing the haram police, and we'll get into that a little bit later. This is something important. Sensitive therapist and the therapy itself. When I did my graduate studies, I focused on Islamic counseling theories and practice. Nothing existed back then. I was using really badly translated books that we had. I talked to sheikhs and scholars and alimas. I did interviews and found barely articles out there on the topic. Now, mashallah, We have Muslim mental health conferences worldwide. We have different community groups having wellness mental health groups in their own communities. One of my recommendations for every community I visit is make sure you have that service in your mosque or center, because you're normalizing that this is part of our psycho-spiritual growth, that we have the support. Have you heard of the Jafari Center in Toronto? Beautiful building, mashallah, well developed over the last 20 years. They actually have a social counseling services on site with a therapist, mashallah. Every center around the world, our masajid need that. Because back in the days of the Prophet, the Masjid al-Nabawi was not just for Quran, for studies, for that. It was a whole social network for our communities. And it is this model that we need to have in every place. That's how you normalize, you make it accessible. And like I said, back then we didn't have any research on this topic. Now, mashallah, where we've gone. And in that research, we discovered that sometimes you don't necessarily have to be of the same culture or the same religious background to have effective therapy. Sometimes I hear from parents, I'm not taking my kid to a white doctor. They're going to ruin their Islam. They're going to push them away from Islam. They're not going to get things. True, there could be some who don't have the cultural training. They're not going to be able to do effective therapy. But when you have that there, because part of my studies that we had to take that cultural training, right? Sometimes you have even more effective therapists from different cultural backgrounds. Sometimes Muslims don't want to see somebody from their own community. Why? Oh, they're going to know about my secrets. They're going to know about our family problems. I don't want to go to somebody who knows us. They're afraid of confidentiality as well. We take confidentiality very seriously, just like doctors and lawyers. In fact, we can lose our license, we can get fired if we don't keep confidentiality. Client, doctor, or patient and therapist confidentiality is vital for proper healing, right? In any case, this idea here, right, is important for parents or anybody who's going. You don't necessarily have to have somebody from the same culture or background or religion to get effective therapy, because nowadays a lot of people are trained in that cultural modality. And of course, we mentioned earlier the shame, right? In terms of perhaps mental illnesses are contagious, right? Sometimes, especially when it comes to marriage, people will not marry someone from a family because, oh, they have somebody who has schizophrenia, or they have somebody who has this, somebody that. But I mean, I would say the same for physical illnesses. Why are we discriminating like that, right? So that's something to keep in mind, because just like physical illnesses, right? Some things can be hereditary and some things cannot, right? So let's take a look here further in terms of why mental health resources should be accessed. So why do you think we should access mental health resources?
Because mental, like when you're struggling with like a mental health disorder or an illness, you can't get over it. You can't like get through it by yourself. You need help. That's the only way for you to heal through this recover. Because if you don't get help, you're just going to spiral into like a dark place, and you might not come out of it.
And it could get worse, absolutely, right? So let's take a look, thank you so much. And let's take a look here at some of the main reasons to help process. What does that mean, the changes in our lives, right? The challenges that we experience. We're humans, up and down, right? We have these challenges. Get back to functioning baseline, right? If we get off track, for example, right? From changes in our lives, challenges in our lives, life events, right? We're not our usual selves. So we need that space to kind of talk through things to get back on track, right? To work through trauma, crisis, life struggles, changes, right? Self-growth, right? Self-growth, learning new skills, setting boundaries, opening horizons, right? Support, getting support through challenges where, let's say, a lot of people may not get support from the people that they need the most support from their families perhaps. Going to a therapist can help you get that support while you go through what you're going through. Loneliness. I see this a lot with the international students that I work with. Loneliness, especially during the pandemic, we've seen that, right? So coming to a therapist, they have a place to talk to somebody. And this is more in line with long-term therapy, where people can have therapy for years. They talk to a therapist, right? Somebody they go to do all of these things, but to have that place where they check in with their wellness all the time, right? So what are the most common illnesses in our community? Shout them out. Go ahead. Yeah? Depression. Thank you. What else? Anxiety. Top 2. We get that, yeah? Believe it or not, this is on the rise. Suicidality, right? Addictions. Believe it or not. Addictions have been on the rise in our community, and we're not just talking about substances here. We're also talking about gambling, pornography as well. That's increased. I still see a few young ages in here, so I wanted to talk a little bit more about the last part. I'm not going to, just some younger people, but perhaps another time. But that's on the rise, and it's a problem because of improper and lack of proper sexual education. So I'm not going to get into it, but I think you understand what I'm saying. But I'll say it indirectly here. This is something we need to be open about in our communities. It's part of our faith. It is taught in Islam. Etiquette, it's all there, right? When we don't teach this properly to our kids, where are they going to get this from? They're going to get it somewhere else, which is why it has increased the addictions in women. Believe it or not, research has shown the Muslim youth services in London did a research survey a few years ago. They found that the people who were calling in to use the services in this problem have been women. And so when we looked at the source, why? It's because of the proper lack of proper education, right? And I know within our communities, taboo. No, it's not. It's part of our Islamic faith, our Islamic education. And we have the responsibility as parents, right, to make sure that we teach this to our kids. If it's too hard for us, then our school teachers here in our centers, our sheikhs, our animas, right? There are ways that we can teach our kids healthy because we know what's going on out there. We see what's going on out there, right? Especially what's been forced in our education system. Our kids are exposed to it regardless, right? My daughter's been asking me questions over the last year or 2. I kind of ignored them before. I kind of switched the topic. I didn't feel she was ready, but I can't ignore it anymore. I have to talk about it in a way that she understands from an Islamic perspective what we view, what our views are, without, because it's become now a human rights issue. If you say anything, it comes back against you, right? So we have to present it in a way, we have to be comfortable talking, even if we don't agree, even if it's not within our beliefs. But we have to be prepared how to talk to our kids about these things. If not, they can access it easily, anywhere, right? You just have to look at YouTube and the ads or some websites and the ads that pop up. We have to be diligent in parental control when it comes to using the internet, but also having open discussions with our children so when they head into marriage, they know what they're dealing with as well. It's part of our holistic, right, upbringing. So culture, taboo, I get it. I come from a culture that's like that. Maybe because I've studied this so much and had to deal with it, I'm just overexposed to it all the time, right? However, you don't have to be like that. But we need to know our basics on how to teach our kids when it comes to etiquette, knowledge, the changes in our bodies over the years, et cetera, et cetera. I think you understand what I'm saying, right? So maybe something in your own community heads you can discuss further if it is lacking, how to approach it so that we can prevent this because it is on the rise. Also, cross-generational cultural issues, right? The different generations that clash. This is classic. I see this everywhere within our communities, right? And I think the younger parents, they have a better hold on this, having growing up here, right? As first generation. But our parents, let's say, who came from abroad as immigrants and the challenges they experience and the fear that they have for us and trying to protect us, right? And perhaps it's done in a way that causes that clash, the lack of understanding. I've done workshops, inshallah, in the future when this pandemic eases, we can do more of this type of engagement where we do this facilitated workshops with parents and youth, okay? And it's a great workshop where we take a look at communication, right? How to communicate with each other. When I've done this over the years abroad and here, what we found in the end when we brought the parents and we brought the youth together where they were communicating and showing what's important to them, The basic common denominator was this. The parents were amazed at how intelligent, wise, and creative their kids were. And the kids, youth, understood where the parents were coming from, that it was a place of love, not control, because that was part of the misunderstanding and miscommunication. We flipped it back onto the parents and said, your kids are wise and intelligent and creative because of your upbringing. It goes both ways, right? It's about bringing together an understanding and softness in the heart, because I know there are very strict parents out there. Perhaps it's culture, perhaps it's Iraqi Asabiya, that kind of thing. We know that, right? But that pushes our kids away, especially if you do it under the name of religion. You're going to push the kids away. Have you heard of this joke where the mother runs into the room at Fajr and says, wake up, there's a fire, wake up. Kids are like, where? In hell if you don't get up and pray. Funny, but you see how you're using religion to put the fear of God in your kids. That's not going to get them closer to wanting to pray when you're putting that fear, right? I see a lot of giggles here. No, you want to do it with love. With love. You bring them to salah, faith, religion, Ahlul Bayt with love. My daughter, since she was very young, even before she became mukallafa, I'd make her pray next to me. Not make her. I'll say, Sallinu Yai, would you come pray with me? I'll give her the choice. Sometimes she'll say no. I'll be like, okay, just come stay and sit near me while I pray, right? And continue that kind of thing. And making prayer a ritual of love, right? Start it with meditation, breathing, hugs, kisses, good vibes, positive vibes. Trust me, your child is going to connect the memory, right? The emotion to the act of prayer, for example, in such a beautiful way. That's my goal with my daughter when I pray with her, She always leans back against me and then hugs and kisses, and that's sweet, that's nice. She's going to remember Salah time was a positive, beautiful, loving experience with my mother, right? So we deliberately need to be strategic in how we bring our kids. Otherwise, we will have this generational clash that have pushed too many people away from outside of our centers. We have spaces. So a lot of youth don't come because they're turned off by religion. They're turned off by, this a negative view of God and this very harsh view of religion, because culture does that, right? I could go on around this, but I'll stop right there and continue on. Identity issues as Muslims. We've struggled with that over the last few years, right? I think all the time, not just last few years, especially when you were living in this bicultural society where, at school you're one thing and then at home you're another. I'll give you a quick example. When I was 16, 17 in my high school, during the days, they would have these air bands. I don't know if you heard of them. So they're on stage dancing to music videos, pretending they're music videos. They'll act out the music video. I remember one time I passed by, I'm like, what is this? And they pulled me in, I'm like, oh my God, in the auditorium. And I'm like, I'm out of here. What are they doing on stage? That same night, my community had a majlis on that same stage. And I could feel the duality of my Muslim identity. During the day, I'm exposed to this. At night, I'm exposed to different things. It's a cultural clash, I think, that we all have experienced in some way or another, unless you go to a Muslim school. That's amazing. If you have a private Islamic school, they don't deal with that. Alhamdulillah, my daughter, she goes to one since she was very young, so she hasn't been exposed to that too much. But we also have a role. If we don't have Muslim schools, we have a role during the weekend schools, or it's a community events, to normalize, say, you know what, yeah, you are going to have that identity challenge. People are going to ask you questions, especially the visible flag bearers, the hijabis, right? So we have to have these open spaces like we did last night, talking about these challenges, right? PTSD, post-traumatic stress disorder, wars, refugees. These are things we also touched upon last night, I recall. Sometimes if you think about our parents, perhaps they've experienced a lot of trauma of war-torn countries, whether it's Lebanon or Iraq. Now we see it in Afghanistan again, right? How it impacts people. They probably were experiencing PTSD and didn't even know it. I don't know if you've seen them suddenly be quiet when they listen or hear things around them. Perhaps you see them pull away, our elders. Perhaps they're remembering something back in the day, right? So things like that. Issues related to domestic violence, abuse, sexual abuse, child abuse. All right, the brother mentioned earlier about abuse from parents. These are things that are common in our communities, not just outside our communities. It happens in the Muslim community. We know it does. And it's crucial that we have the safe space, right, to make it safe for women who are fleeing abusive partners, right, that they can come to us. We're going to support. We're not going to judge. A few years ago, a Somali Muslim woman with 4 kids left her abusive husband. The community did not support this woman financially. She went back to him. He killed her and the 4 kids and committed suicide. This happened within our communities. We don't want these women to go back to that space. I'm speaking obviously, high level here. But when we get into the details, there's so many factors that keep people in these types of relationships. Money, family, the community, society, shame, love, yes, love as well. It's difficult, it's painful. It's not easy getting out of these situations, especially when there's a dependency, especially when they're isolated. Abusive situations, okay, scenarios, there's an isolation. The partner isolates the other partner from the community. They're left to rely on them. It's a process, right? Perhaps one day we can get into the details of it. I don't want to spend too much time on it because it's a sad topic. At the same time, we need to give it its value because it is happening. Now, when I talk about abuse, it's not just against women. It's also against men. It comes in different forms. Lack of respect, financial abuse, disrespect to the father in front of the children. You're creating a cycle where these children are not going to respect men. There's huge initiatives now on men's mental health in our communities, right? Because men, and we'll get into gender variances in a moment, men are taught not to show emotions. Be strong, tough, right? We don't show emotions, right? Men also have mental health, just like women, just like anybody else. You saw the statistics earlier. Men are most likely to succeed in committing suicide, right? Men's mental health also matters. And men also experience abuse just differently. May not be physical, definitely verbal, definitely emotional. It's there, right? Kids see this. They see the cycle. Right? They grow up doing the same as what their parents, or the opposite. They say, I'm never going to be like that. It could go either way. But we need to be able to be comfortable in our communities and our societies to be openly talking about it and creating a safe space. If a woman comes and needs help and support, you don't turn her away and say, what did you do to make him hit you? We've heard these scenarios before. No, what can I do to help? What do you need? Do you want to stay with me? Let's talk to the local head of our community. Let's see how we can reconcile this. I say one slap is more than enough to go away from this situation. I have seen cases where the man has done tawbah and has stopped because they realize what they're doing is wrong, because they've been through that cycle. Some people say, إحنا تربينا هيجي. We were brought up like this. That's all I ever know. If this person is not willing to make the changes, they're going against our own Islamic beliefs when it comes to self-awareness and working on akhlaq as-su', right? The negative vices that we need to work on. This is something very important, especially when it comes to sexual abuse. This is something that can happen from people we know, not just outsiders. People we know within our own families can do this to our children. Please be aware of your children's behavior around people. Yes, family, but just please be careful and be aware. Because I've seen this happen. I've seen this happen. People in position of power, of trust, and they violate that. Be aware. I'm not saying this to scare you, but to be aware, right? So let's continue on here. Islamophobia. This is something we've all been experiencing at some point or another. If not us, we've seen it. Just this summer, London, Ontario, you saw the Islamophobic attacks and how it all impacted us, right? So these are things that we are also experiencing. And also looking at eating disorders. This is something that I'm seeing on the rise within our communities as well. Body image issues, right? These are things that are common as well, especially when it comes to fasting as well, that, there are issues around that. So some things to be aware of. What else? I know I've seen OCD, obsessive compulsive disorder, especially when it comes to tahara and najasa and, oh, did I close the door? Did I do wudu properly? Did I, these things that can come out in that form, right? What other challenges have you seen in the community? Or we've pretty much touched everything? I didn't hear you properly. Some people. Forsaken? You mean like excluded? Why?
Maybe they feel like Islamic society that most people are non-Islamic.
So that.
They were like alcoholic before, or they have like some physical.
Disabilities, yes. So people who are excluded because of physical disabilities, perhaps they're not religious, or they've done things before, and yes, oh yeah, judgment from the community, right? Sometimes we have to admit, some communities I've seen around the world where they kind of have like their own little groups and cliques within the community, right? They don't want these people, they don't want these people. They're from the Junub, they're from here, they're from there, they're from there. They're from this family, لا احنا ما نحكي وياهم دول, like this kind of cultural tribal attitudes. Yes, it's almost like a mafia. That's what, when I was in Edmonton last weekend, when I kind of mentioned that, they're like, it's like a mafia. Yeah. Inshallah, I don't get the vibes here, but it's kind of everywhere, Yes? Different types of phobias, yes, right? Yes, that's also something. Seasonal affective disorder, also known as SAD, or the winter blues, right? Yeah, that's also pretty common. It's not just common, let's say, within our communities. Even like white Canadians born and bred here get affected with that. What happens is with the seasonal changes and less sun outside, what happens in darkness, dopamine, which is a hormone in our body, is produced in the dark. Dopamine is linked to depression. So that when there's more dopamine in our systems, right, we're more likely to experience perhaps depression, serotonin, yeah, right? So this is what happens in the winter months perhaps, which is why it's important to get light therapy, sit near a window, make sure, you do what you need to do, get exercise and so on and so forth to get the stress hormones out, get endorphins in your body. That's a good one. It's the first time I hear it from the Muslim community. It's something I deal with often with different people, but I don't hear it from the Muslims. So let's take a look at here some of the signs of depression and anxiety. So for those of you who were here earlier today, we spoke about depression, anxiety, and nutrition. I did not see one gentleman here. I did not see any of the men come earlier. I think you got the wrong message. We weren't cooking. We were not cooking. We were talking about mental health and nutrition, and the sister did a demonstration of easy foods to prepare that were delicious, that we all sampled. You lost out. خسارتكم. Sorry, I'm putting the men on the spot here. I know, I'm assuming you were busy, but I think the wrong message got out. It wasn't a cooking show. Although we did have fun, preparing some things that were easy, you missed out on the chocolate spread. What was your favorite? The chocolate spread, the smoothie that we had with the bananas, the matcha smoothie, and then we also had, what was the first one that we did? The overnight oatmeal. Yeah, it's good stuff. That's okay. We have food for later, don't worry. أهم شيء المعدة. But what we talked about earlier, similar to what we brought up here right now, in terms of recognizing the signs and symptoms of depression, whether within yourself or anxiety or within others. Now, just because, let's say right now you're experiencing all of that doesn't necessarily mean you're clinically depressed or clinically anxious. No, right? To be clinically diagnosed with any of these types of challenges means that you are consistently experiencing it for at least minimum 2 weeks or more. Consistently. We all have ups and downs. Some days we feel like this, right? Other days we feel like that. It's normal. We all have ups and downs as human. We're human. We're going to feel that. But if it's consistent and it's preventing you from reaching your full potential, right? Contributing to society, succeeding in your schoolwork, contributing in work, in your community, et cetera, then it's an issue. Then it's something we need to go see a doctor for. Okay? So these are some of the signs and symptoms. I'm not going to go through everything here, but just things to watch out for and to be aware of. So let's take a look at counseling. Who can tell me what counseling is for a beautiful Subha from Abu Fadl al-Abbas? I stayed on the side of Abu Fadl al-Abbas in the Ataba Hotel, which is why I got most of the things from al-Abbas alayhi salam.
The help of the specialist they already had an education and learned how to deal with the situation, the experience they're dealing with one-on-one cases.
Thank you so much for sharing.
As a person in a specific issue, they may not know what that is.
Right.
They're just going to go off the roots and kind of
Absolutely. Ahsantum. Can you please pass it along? Thank you so much. Now let's take a look at this. Oh, it's right up there. I thought I didn't put it. So this is a technical definition here that we see from, let's see here, from the dictionary. And it's about that professional guidance of the individual by utilizing psychological methods, especially in collecting case history data, using various techniques of the personal interview and testing interests and aptitudes. Sounds like pretty heavy definition. I don't like that definition. So I kind of made up my own. When I meet people in first time in the session, I kind of give them this definition of what counseling is. So counseling is a safe space for you to talk about whatever it is that you've come in for, right? To help you reach your goals, to work with your problems, or provide you with strategies to cope with your challenges. Notice I didn't say solve your problems. We're not here to solve your, we have problems. We all do, right? Some people come in and say, and I'm like, what brought you into counseling? I want to be happy. And I'll look at them and say, me too, I haven't figured that out. So it's not a problem solving per se space, although we do problem solving, especially when it comes to academics. Huh? People come in with struggles for academics and things like that. And so we look at what can we do to help you get back on track with school, stopping this addictions issue, how to talk to your parents, et cetera, all right, problem solving. But it's about strategies, coping with the challenges that you're dealing with, right? It's done with no judgment, just acceptance. Funny thing is when I go into the waiting room, right, pre-COVID, we're slowly getting back on campus with people in front of us now. When I go into the waiting room with my hijab and I come in and then a Muslim student sees me, they run the other way sometimes. The look of horror on their face when they see a Muslim counselor come out to get them. Because they're so afraid of the judgment that's going to come their way for all the haram things they've done. But that's not the case. When they come in, we're not even talking about Islam or anything like that. We're talking about the issues that they came in for. We look at how to strategize, how to cope, how to problem solve. And I notice at the end of the session, they will say things like, you know, I used to wear the hijab. Or, you know, I used to pray. I used to read the Quran. And so I would put it back on them and say, so what do you want to do about that? How is this important to you? What do you want to do? And they'll say things like, well, I want to do it more. I want to think about getting back to wearing hijab. Or, you know, I want to be able to do my prayers. I want to read more Quran and du'as. I want to get more involved in the community. I want to come to the center. Okay, so how are you going to do that? You notice I didn't give the solution. I gave the space for them to talk about what the issue is and how they can incorporate it into the action plan for the treatment plan, right? And then they can incorporate it. Okay, so maybe you can set a timer on your phone reminding you for salah if you're not used to the routine of it. In our communities, it's drilled into us from kids, right? From we were kids. Salah, 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 salah. We know it's salah time, you're still playing that video game. That feeling you have right there, like get off that game, right? Something is dragging you. It's embedded in us. But people who don't do it for a long time, you lose that connection. We want to create that connection again, but a positive way, like we said earlier with our children, right? So then we bring it back, or how are you going to bring it into your treatment plan? And then they start talking about all the things that they've done, and because they find there's no judgment. A lot of the issues we have in our community is judgment. Somebody comes to you with an issue, right away we become the haram police. Right away. Haram police. You're going to go to hell for having these thoughts. You're going to this, you're going to that. Is this person going to come to you for help? Again, never. You were probably that one person they felt they could come to. Not only will they not come to you anymore, they probably won't get help at all. We want to make that safe, open space for people to come talking about all sorts of things, whether it's short-term counseling, crisis counseling, long-term, talking about stress, anxiety, depression, relationships, that's a big one. I'm trained in couples counseling. It's my least favorite. I don't do it. I don't like it. There's his side. Dr. Osama Al-Attar told me one time when we were talking about this, he said there's his side, her side, and the truth. How do you deal with it, right? Anyhow, it's my least favorite one. I really enjoy doing therapy when it comes to self-development, growth, things like that. When it comes to looking at identity, building yourself, these are things that I really enjoy doing. Most of the things I see are under these areas here. This is commonly what we see with university students, right? The list goes on. However, it's something if I can't do or it's not within the bounds of a psychotherapist, then I would refer. I don't do, before anybody comes and asks me to be their therapist, because every day I get a message or email, I don't do private practice. Because I work full-time at the university and I do this kind of work. I don't have time for private practice. Shall in the future when I retire, perhaps. What I do have, however, is a list of specialists. Muslim Shia therapists, psychologists, psychotherapists, social workers that I trust and that I refer people to, including a marriage psychologist, Dr. Saeed Kianpur. He is a specialist in this area. God bless him, because I can't stand that. He loves it, mashallah. It's beautiful in the sense, in the end, when you can reconcile people. But when I was doing it with some people, like I said, his side, her side, and the truth. And it's just so hard to get there. Anyhow, there are people in our community now that we can turn to, that we can trust to help with these challenges. We didn't have that 10, 15 years ago. Or if we did, we didn't know they existed. All right, so let's move on. I'm aware of the time. So let's take a look here further in terms of looking at why do we avoid counseling? Why do we avoid counseling? Why do people avoid counseling? Even people who are struggling with mental health illnesses. Go ahead.
They might feel like a burden if they don't want to.
Yeah, they feel like a burden. I don't want to come to you with this and dump this on you. You've got your own problems. Perhaps. What else? Stigma. The judgment. Yes. What else?
Time management.
Okay. Meaning? What do you mean by time management? They don't have the time? Ah, okay. You don't have time to take care of yourself. Yes. It's somewhat like with our physical health. You've been exercising, you've been eating healthy for a while, you're taking care of yourself, you're eating, sleeping, exercise, and then all of a sudden, you have a problem. The first thing to go is exercise, which exasperates your stress, right? Which exasperates the stress even more, right? So this is something that is really important to understand, that when people avoid counseling, it's because of fear, the stigma, people will find out, right? Shame, people will think I'm weak, I have low faith, I'm not a good Muslim. That they turn to the, you need to pray more, you need to do more, that kind of thing, right? So it's also, like we said earlier, shame of disclosing personal family issues to outsiders, right, which could affect marriage prospects, right? We're very hush-hush about our skeletons in our closets, right? Especially when it comes to marriage. It's important that we are open about things that could affect our children getting married, right? Things like that. Mislabeling. People don't want a label on them, right? Going to a doctor and getting a diagnosis means that they have now a clinical label. Is this going to affect me when I apply for jobs later on in life, kind of thing, right? So these are some of the fears that we see as well. Also, Sorry? The misconceptions, like they feel like people are going to have the wrong idea about us. Yeah. Yeah, people have the wrong idea about counseling perhaps as well, right? Okay, and of course the lack of faith, I think we know that one, right? And so people who are struggling with mental health, why don't they seek help? Well, it's because perhaps, like we said earlier, the burden, perhaps they want to deal with it alone rather than show weakness. There's also the denial. Denial. كل شيء ما بي يعني، إيش قاعد تحجون؟ أنت المريض. There's nothing wrong with me, you're the sick one. Projecting back, especially the abuser. The abuser. You know, I forgot to mention this earlier. Let me just quickly go back to something I just realized. When we took a look at, I forgot to mention mood disorders. Mood disorders when it comes to bipolar, right? Borderline personality disorder. That is something that is disguised in abuse. This personality disorder, I've seen it so much in our communities, and it's disguised under an abusive personality. This is one of the hardest personalities disorders to treat, right? Take a picture. So this one here, I find it comes with abuse. The person who's abusive has this disorder sometimes. They elevate you, love you, and glorify you, and then they drag you down under your feet. One moment you're up, they bring you up, and one moment down. And one moment they gaslight and project onto you, you are the one. You, not me. Put it back. This I found over the last few years, I've seen it more and more within our communities. And it's something we need to see. We need to be openly aware that this can happen in our communities to get the proper assessment. Now, the problem with this issue, somebody who has this, okay, because they're denying it and they're projecting it onto somebody else, they will not go get help for it. They will say, you have this disorder. There's nothing wrong with me. It's very challenging. This is where we need a community intervention, perhaps, sometimes. People that they would respect to get them involved, to try and help them to get this kind of support. Because it can truly, truly destroy a family and can really impact partners and the children. But when we get the right support to help, alhamdulillah, it can really help people deal with it in a better way. So let's wrap up this last part here. I think it's straightforward. Is counseling only for people who are affected with mental health illnesses? No, right? We said it's for people who may not be necessarily dealing with mental health illnesses per se, but they need that safe space to talk, to process, to get things out, etc., etc. All right, we're getting close to the end here. Let's take a look at, before we do this, how about we just all stand up? All stand up, stretch, do a little stretch, get the blood flowing. Maybe some jumping jacks, push-ups, sit-ups, no? Some stretches. Deep breathing and exhaling. Maybe tiptoe. When you do that, you're stretching as well. Wow, the ladies are still stretching. The men just sat right back down. All right. Whenever you're ready, you can sit back down. Whenever you're ready. Let's also do a loud salawat ala Muhammad wa ali Muhammad. All right. So this is really interesting here when we talk about gender variances and mental health. Already I can tell by just looking at how many men we have and how many ladies we have in the audience. There seems to be more ladies than men. So I'm going to pose the question out there. Why do you suppose, right? This question, why do you suppose that more women come to these types of events than men? Yes? Why do you think that more women attend mental health events than men? So they physically can't be here. Yeah? Maybe? Brother's making excuses. Go ahead. Sorry? In denial. Okay. So perhaps there's a denial, yes?
A lot of men feel that having negative emotions makes them less masculine and makes them less of a man.
Mm-hmm.
And so we're hesitant to acknowledge those things, and we consider that keeping it all inside makes them strong and makes them more of a man. And also the
She hit all the points, right? Was there anything else that anybody would like to add to that? Remember what we said here today. We want to be comfortable with these topics. We're going to leave with compassion and ambassadors to our community. And this is something we need to tackle as well, right? Gender variances when it comes to mental health. So look at this question. Muslim men usually deny or have more negative attitudes towards seeking help. Why? Because of what the sister said, perhaps, right? Men are brought up to not show emotion. Men are brought up to be tough and strong and not show that emotion, right? And when we see that, what does it do? What does it do? It then prevents men from seeking help when they need it, which can then lead to more complications, right? And so these statistics here, when we talk about, is it true that mental health illnesses affect more women than men in the general and or let's say the Muslim population? I'd say the statistics are skewed because it comes back to what the points we were talking about, right? We know, for example, that women are more likely to talk about their problems. Not all women. There are some women who will keep it in. It's not necessarily a masculine trait per se, but I met a couple in London, Ontario a few years back when we did this, where this woman said, my husband just won't stop talking about things, everything. I'm the one that keeps it in. So they were the opposite of what stereotypically we see, right? So women most likely will talk about their problems. Now let's do a little side note here with couples, right? When a wife comes to a husband with her problems, right? She wants to talk about it. What does the husband do? He tries to shut it down. Oh, that's not going to go very well now. That's not going to go very well to shut it down. What else? We're going to teach you young how to do it well. Shutting it down is not going to solve the problem. That's going to make it worse, right? But what do you mean by shut it down? What did you mean by that? De-escalating. How do you de-escalate? Okay, so we're still along the same line here. De-escalating it, perhaps by listening. Men tend to problem solve. If you look at the book, Men Are From Mars and Women Are From Venus by Dr. Gary Chapman, he does an amazing job. He's a therapist, has been over, I think, 40 years, even more now, with couples. This is an excellent book to give to young couples who are about to get married. For those who've been married a long time, it is a marriage saver. I've given this book to my own siblings before they got married and recommended it. It's an excellent book. It goes across cultures. I've heard this from students from China, from India, from Africa, from our own cultures. It's excellent. It has these basic concepts, and this is one of them. When a wife comes to her husband with a problem, the husband is the problem solver. That's how men's minds think. They want to solve the problem. The woman, what does she want? To be heard and listened to. She doesn't want a solution, maybe not right away. Okay? Are you listening? Are you hearing this? Yeah? Okay, good. We're learning young, right? So even as your sister, okay, or cousin or anybody female, right? She comes to you, she starts talking to you about a problem. You're not going to solve it right away. You're going to listen. You're going to do exactly what you did. Yes. Listening. Yes. Oh, show empathy, right? Right? Women, we do that, right? We talk to each other, right away we get into this kind of language, don't forget, yam shahab too, right? So we say this but then this is showing support. Showing support. When you listen to your partner, when you listen to your child, When you listen to somebody who comes to you with a problem, with no judgment, no problem solving right away, just listening, that feels so good. That person feels relieved. Then we can look into problem solving. So denying it will escalate the problem. Ignoring it will escalate the problem. If in that moment you truly cannot hear it, okay, you really can't listen to it and can't hear it, say, I would really love to be able to help you right now. I can't. Can we talk about this a little bit later?
That's that.
No, because you're acknowledging and validating, oh, that must be really tough. But right now, I have to go do this. Let's talk about this later, right? You're validating, oh, yes, it's tough. And second, you're saying, we're going to talk about this, just maybe not right now. Ladies, if you need to talk about it just right now, go call your friend or your mom or your sister, okay? Maybe he can't handle it in that moment, all right? Okay, so let's get back on track with this because I always tend to get off track with this part, but it's important. It's important when it comes to mental health, communication, and the genders. It's not because, well, we are wired differently, right? But it's also because the way we have raised our men. We have taught them not to show emotions, keep it in. And it's ironic given the fact that in our communities, especially the Shia Muslim communities, we are encouraged to show emotion in our majalis. Let that tear come down for Abu Abdullah. Let that tear come down for Ahlul Bayt. We encourage that, right? So why is it outside of the majalis we can't do that? Did the Ahlul Bayt, the men of the Ahlul Bayt, did they not show emotion in difficult situations? Yes, they did. If you just look at Karbala, right? If you look at the history and the lives of the Imams, did they not show emotion to the trials and tribulations they experienced? Are they not the epitome of what a man should be if they taught us, right? They taught us how to be human and work towards that perfection. We talked about perfection last night. There's no such thing as perfection. We strive towards our best, but the Ahlul Bayt have taught us that. They've also showed us how to show emotion. They used to have gatherings with people. They used to talk to people. How are you? How are you? What's going on? They offered spaces for people to talk about what's going on in here. Does that mean they were judging them as weak when they talked about these problems? Men as well, right? Imam Sajjad alayhi salam spent his life crying whenever he saw water. That a sheep was given water before slaughtered, but his father was not. He showed emotion for the rest of his life whenever he saw water. Does that mean, astaghfirullah, that Imam was weak as a man? No, right? Showing emotion, equivalent, proportional to the situation. So we have a responsibility as a community, as mothers, as fathers, as brothers, sisters, to raise our young men as Hussainis, with chivalry like Al-Abbas alayhi salam, strength and compassion. Having animals in the house, by the way, teaches children compassion. Have you noticed your children with animals, how they are? Unless they're beating them and throwing them against the wall, you can teach them young, no, you can't do that. But teaching children responsibility through cats, for example, or hamsters or fish, no? You want a dog, right? No, you don't want that at all, no. But if you look at that, and one of my colleagues who is retired now, she raised 2 men. One of them became a therapist who works in her office. And she said that, I learned that from her, is having animals teaches boys especially compassion. SubhanAllah. Cats were favorites of the Prophet. You've read stories about how the Prophet liked cats, right? And they're a blessing in a home. I have a cat, his name is Loz. He couldn't make it today, but he sends his salam. So back to this, gender variances. Why am I spending time on this? Because we need to have equal amounts, if not more on this side, in these types of gatherings when we talk about mental health. It's all about our mental strength, right? All right. Interestingly enough, a lot of my clients are Muslim and come from the Arab communities. Pre-COVID. Now it's everybody. But I noticed pre-COVID, I saw a lot of young men from the Muslim community. Alhamdulillah, they felt safe to come. We wanted that. In fact, when some of them got help, they told me, because they were first year, they were failing, they were using substances. When they got the support to get back on track, they were looking out for the younger ones. Say, go see Buraq, go. Go get help, right? So that's normalizing it. It's important to offer these open spaces for our men in our community to feel safe to talk about emotions, right? So that they can get the appropriate help as well. All right, moving on. How do we help families or friends? Similar to what we just talked about, right? Listening. Listening doesn't necessarily mean that you have to like it. And that's what acceptance is. When somebody comes to you and says, I think I've had I have thoughts about wanting to end my life. You're going to go to hell for having thoughts like that. Judgment. That's judgment. Right? Accepting doesn't necessarily mean you have to agree. Acceptance means listening openly, letting them talk, right? And encourage support for them. Do you want to go together? Why don't we call Nasiha? Nasiha is a youth helpline. It was only for Muslims before. Now it's open to everybody because of the demand that they've been having, because it is faith-based, right? Nasiha, look it up on Instagram, social media, free to use. Now they even have, inshallah, in the GTA, in the Toronto area, they're going to have actual places, an actual therapist face-to-face you can access for free. They're building a new building there, mashallah, with the support of organizations like Nasimco, right? For all Muslims. Listening, accepting, encouraging. How about we call together? How about we go see your doctor together? How about we meet up for a coffee and chat? I'm not a therapist, but I'm here to listen, right? This is the type of open, compassionate attitude that is vital that we have in our communities, okay? And speaking of resources, like we said, Nasiha. If you look under psychology today, this is a slide worth taking a picture of. If you look at psychology today and just look up Muslim counselors, right? Let's see if this will work here. It doesn't have internet? Okay, it's fine. If you just look this up for Calgary, I found a whole list of people. I don't know them personally, so I can't tell you, yes, I know this person or that. But you have a whole list of people of Muslim background who can do therapy. Look them up. You can contact them. Sometimes they can do a free consult to see if it's the right fit, right? Look at their qualifications. Remember that as well, right? I recommend every single community, and just like I recommended to the Marja'iyya, to have the mental health first aid training. There are people who are trained in this. Unfortunately, I'm not trained in it. I wanted to get the training, but my work said it's not in your capacity of your work. However, there are people who are trained in this that can come into your centers, okay, and can do a training just like first aid. You know how you get a certificate at the end? That if you see somebody choking, you can do the Heimlich maneuver on them. You could do CPR. I almost called it PCR. Yeah, CPR. They give you basic skills. This is the same concept. Mental health first aid. You can get that. Your teachers, principals, anybody who's a frontline worker, or anybody who's interested can take this course, and you will have a certificate in basic mental health first aid. Highly recommend it for our communities to do. Okay? And then there's also the ASSIST training, the Applied Suicide Intervention Skills training. This is something that's very useful to have as well. Somebody comes to you and talks about wanting to end their life, then you can do a step-by-step with them to kind of get out of that negative space to be able to get the appropriate support. This is also very useful. And if you go to CMHA, the Canadian Mental Health Association of Canada, Calgary, then you could see a variety of resources on their website as well, from education to trainings to workshops to local practitioners, et cetera, et cetera. You've got that there. All right. Let's quickly go through the importance of self-care as we lead to the ending of our session today and into the meditation that we'll do, is how to ask for help and why it's important to seek help, right? It's really important. Inshallah, by now you guys are feeling that compassion towards yourself and others, that you realize how important it is to take care of ourselves. This means our basic stuff, right? Inshallah, in the future, we can do this presentation. Otherwise, you can go on the Muslim Counselor YouTube page. I've done these presentations. You can see them there. But the basic self-care is the routine of balance, right? Of eating well, sleeping well, exercise, which is why this weekend we wanted it to be a holistic approach with the nutritional that we did earlier. Looking at spiritual inner peace. This is also, like we said earlier, it's very much linked to our mental health. Medication if needed, not to shy away from that. I've given many examples today of why that's important and how it can help you. Sometimes there are side effects that take a while to kick in or leave you. And sometimes the medication is not the right fit. That's important to understand as well, that sometimes it takes time to find the right medication. Good relations with friends and family. I hear this often. You know, I'm in an abusive household. My parents, my partner, it's toxic. How do I cut ties with them? There's salat al-raham, right? Sometimes you have to move out. Sometimes you need to cut that space. Maybe there are some relatives who are toxic and, you know, you just can't deal with them. Do the basics. This is what our Islamic scholars tell us. Do the basics. Text them, Assalamu alaikum, how are you doing? Eid Mubarak. Basics, you know, and not emotionally engage. Right? That's another workshop that I do in terms of how to deal with toxic people. And you can look it up again on the Muslim Counselor YouTube. However, quickly, it's not about engaging yourself emotionally. When someone is really upsetting you, you have to take a step back, okay? Put that distance like you can do with your hands, like in your head. Like do that, block them. Don't let it hit you, block here, and let it bounce off you. Okay, so put that space. Do not emotionally engage when they're trying to reel you in, trying to make you feel bad, because it's power. They're trying to do that abusive power. Get counseling. Go to a therapist. Talk to somebody. Of course I'm going to say that, right? Attend lectures. Listen. Come to these events. Do more of these, not just one time. This one-off is not going to help. Again, that was advice I gave to the Marja'iyya today. One-off programs to address an issue is not going to solve the issue. It's not going to help. It's a great introduction, absolutely, just like this is today, because there's so much more, right? You notice each one of these slides is a whole workshop on its own, right? So it's really important to seek knowledge in this area as well, inshallah. And I always like to end off with this beautiful quote that has been attributed to Amir al-Mu'mineen alayhi salam, Imam Ali ibn Abi Talib, where he says, your remedy is within you, but you do not sense it. Your sickness is from you, but you do not perceive it. You presume you are a small entity, but within you is enfolded the entire universe. You are indeed the evident book by whose alphabet the hidden becomes manifest. Therefore, you have no need to look beyond yourself. What you seek is within you, if only you reflect. And that reflection comes through everything we have spoken about today. Put it all together within you and seeking that support outside as well, right? There's this joke that I'm sure you've heard of in terms of seeking support, where this man gets deserted on an island, right? And he said, I have faith Allah is going to save me. He's going to save me. So the ship comes along to try and save him. He's like, I'm not getting on that ship. Allah is going to save me. This helicopter comes, try to get him off the island. It's like, no, thank you. I'm not getting on the helicopter. Allah is going to save me. Allah tells him, I'm sending you. I am sending you the ship and the helicopter for help and support. Sometimes our support does come from outside, that we need to reflect and look how to get that support, who to turn to, who we can trust. And inshallah, all of you now have become ambassadors, basic mental health, of what it's all about, how to ask for support, how to connect, how to just understand what it's all about. It's not as scary as we think it is. Not as scary as we think it is.